We have some very impressive response rates in our institute. We've analyzed 26 patients that have a follow-up longer than 6 months, but in total we've already treated more than 50 patients now since the start about 1.5 years ago. And our overall response rate is over 80%, and we have a complete response rate of 61%, so that's very promising.
Just to dig into the details there, the patients are being treated with how much T-VEC?
It really depends. It basically all depends on the tumor load. So the lower the tumor load, often the lower amounts of courses they will need. But we see a general of about 3 or 4 months on treatment before reaching a complete response. Yeah.
All in the early metastatic stage?
Yes, most of them are. We have stage 3 and stage 3B and stage 3C mainly.
In terms of treatment tolerability, the response rate sounds great, but how is it being coped with?
Well, that's actually, I think, the best part of T-VEC therapy. It's very well tolerated. It has a very low toxicity rate. People often only have flu-like symptoms or mild fever for only 1 or 2 days, and it resolves quickly. Yeah.
And how is this comparing to other treatments in the area? Is it a valid alternative?
It's a very valid alternative. It's actually a very elegant alternative, I think, whereas most systemic immunotherapies have way higher toxicity rates than T-VEC does. So it's a good alternative also for frail and elderly patients. Yeah.
Are there any plans to expand the patient cohort beyond the 50 or so patients treated so far?
Yes, we are including patients every day, and we hope to treat more patients in the future, yes.
And outside of the early metastatic stage?
For now, in the Netherlands, it's only reimbursed for stage 3B, C, and 4M1A, and I think that is the best category of patients as it is, so I don't think that will be expanded.
Is there any timeline for the trial which we should be aware of? Any follow-up, further data coming soon?
Yes, as I said, my poster here is on the 26 first patients that achieved a follow-up time longer than 6 months, but as of now we're already 6 months further than when we started, so I think in about 6 months we'll have a far larger cohort, and we're also collaborating with the other 3 centers in the Netherlands that also use T-VEC monotherapy, and together with them we have around 100 patients treated for now. So.
And any final thoughts on the role of T-VEC possibly in combination with other immune or regulatory agents?
Yes, we are participating in a multi-center trial, the Master Key trial, where pembrolizumab is combined with T-VEC or placebo. And we hope to hear some results of that maybe next year or the year thereafter.